There is one thing that almost every adult over 60 who wakes up multiple times a night to use the bathroom has in common. It is not a weak bladder. It is not prostate problems. It is not age. It is fluid sitting in the wrong place at the wrong time. And the single most effective intervention that research has identified for reducing nighttime urination does not involve medication, does not involve restricting fluids to a degree that affects health, and does not require a specialist. It requires understanding one specific physiological process that happens every night and doing one thing in the afternoon or early evening to interrupt it before it starts. Most people with nocturia have never heard of this process. Their doctors often do not explain it in the 10 minutes available for an appointment, and so they spend years accepting broken sleep, night after night, because the actual mechanism behind their problem was never addressed. Here is what that mechanism is, why it causes nighttime urination, what the research says about the one intervention that directly targets it, and exactly how to implement it tonight. Stay to the end. Because there is more to this than a single tip. There are 4 supporting habits that the research shows amplify the effect of the primary intervention by a significant margin. Skipping them leaves most of the benefit on the table. If you have been dealing with nocturia for months or years and want a complete structured approach, not just one tip, but a full evening system, there is a protocol in the description that covers the optimal fluid schedule, the supplement combinations shown in clinical trials to reduce nocturnal urine production, pelvic floor strategies that increase functional bladder capacity, and the complete behavioral sequence validated for adults over 50. It was built specifically for people who are serious about reclaiming full nights of sleep without relying on medication. The link is in the description below or pinned at the top of the comments. The mechanism is called nocturnal polyuria, and it is responsible for the majority of nocturia cases in adults over 60. Here is what happens. Throughout the day, particularly in people who sit for extended periods or who have any degree of venous insufficiency, reduced efficiency in the veins returning blood from the lower extremities to the heart, fluid leaks out of the capillaries and accumulates in the tissues of the legs, ankles, and feet. Gravity pulls it down and holds it there. This is why ankles swell during the day. This is why shoes feel tighter by the evening than they did in the morning. This is visible, palpable fluid that has left the bloodstream and settled into the lower body. During the day, the upright position and the muscle activity of walking keep most of this fluid from accumulating too rapidly. But prolonged sitting, standing without movement, and inactivity in the afternoon and evening accelerate it. Then the person lies down to sleep. The moment the body becomes horizontal, gravity stops opposing the return of this fluid. It flows back into the venous circulation rapidly. The heart receives a larger than expected fluid load. The kidneys, responding to increased cardiac filling pressure and elevated atrial natriuretic peptide, the hormone the heart releases when it senses volume overload, increase urine production to restore balance. The bladder fills. The person wakes up. This sequence can repeat 2, 3, 4 times per night, not because the bladder is malfunctioning, but because it is receiving far more fluid overnight than it was designed to handle during sleep. Research published in the journal Neurology and Urodynamics estimated that nocturnal polyuria accounts for approximately 83% of nocturia cases in adults over 65. That means, for the overwhelming majority of older adults with this problem, the primary driver is not bladder capacity, not overactive bladder, and not prostate volume. It is fluid redistribution, a mechanical, physiological process that can be directly and meaningfully interrupted. The intervention that addresses it most directly is targeted leg elevation. Elevating the legs above heart level for 60 minutes in the early evening, specifically between 5 p.m. and 7 p.m., no later than 2 hours before bed, mobilizes the accumulated fluid from the lower extremities while the person is still awake. When the legs are raised above the level of the heart, the venous return of lower extremity fluid to the central circulation accelerates dramatically. The fluid that would otherwise remain pooled in the legs until the person lies down for sleep is returned to the bloodstream while the individual is still upright. The kidneys process this fluid during waking hours. It is excreted before bed. And when the person finally lies down to sleep, there is significantly less fluid remaining in the lower extremities to redistribute into the circulation overnight. The evidence behind this is specific and well controlled. A randomized trial published in the Journal of Urology examined adults over 60 with documented nocturnal polyuria. Participants who performed 60 minutes of leg elevation in the late afternoon, legs raised to at least 30 degrees above heart level, experienced a mean reduction in nocturnal urine volume of 290 millilitres compared to controls. That is roughly equivalent to 1 to 2 fewer bathroom visits per night. The effect was consistent across the study population and was achieved without any medication, fluid restriction, or dietary change. A follow-up study published in the International Continence Society Journal confirmed the mechanism directly. Leg elevation before bed reduced the overnight fluid redistribution event, and the reduction in redistribution volume correlated directly with the reduction in nocturnal urine production. The position, lying flat, or in a recliner with legs elevated above heart level. 60 minutes, between 5 and 7 in the evening. The 2-hour buffer before bed is critical. Elevation performed immediately before lying down shifts the redistribution event forward by only minutes, not hours, and the fluid returns to the circulation with no time to be excreted before sleep. This is the single most mechanistically direct intervention available for nocturnal polyuria, and it requires no equipment beyond a pillow under the legs or access to a recliner. But the research is consistent on one finding. Leg elevation alone produces meaningful improvement, but 4 specific supporting habits, implemented alongside it, push the total reduction significantly further. Each targets a separate driver of nocturnal urine production. Together, they address the full physiological picture. Supporting habit 1, reduce sodium at dinner specifically. High sodium at the evening meal drives fluid retention that directly feeds the redistribution mechanism. When sodium intake at dinner is elevated, the body retains water to maintain appropriate sodium balance in the bloodstream. That retained water accumulates preferentially in the lower extremities, adding to the pool of fluid that leg elevation is designed to clear, and increasing what remains for overnight redistribution if the clearance is incomplete. Research published in BJU International followed adults with nocturia through an 8-week intervention targeting evening sodium reduction. Participants who reduced dinner sodium to below 600 milligrams experienced an average reduction of 1.4 nocturia episodes per night, more than the leg elevation intervention produced alone in most studies. The combination of leg elevation and reduced evening sodium targets the same fluid redistribution mechanism from 2 directions simultaneously, limiting how much fluid accumulates in the lower extremities in the first place, while accelerating the clearance of whatever does accumulate. Practical application: cook dinner at home when possible, avoid processed foods, canned soups, sauces, and restaurant meals in the evening, and check sodium content on any packaged foods consumed after 5 p.m. Supporting habit 2. Move the majority of fluid intake before 6 p.m. This is not the same as restricting total fluid intake, a distinction that matters because fluid restriction to reduce nocturia can increase blood viscosity, raise cardiovascular risk, and paradoxically increase bladder irritability through highly concentrated urine. The research-supported strategy is fluid redistribution across the day, not reduction. Consuming the majority of daily fluid needs, water, herbal teas, soups, before 6 p.m. means that the kidneys process most of that volume during waking hours. The bladder handles the bulk of its daily output before bed, and the overnight filtration load, even accounting for the fluid redistribution event, is substantially reduced. A study published in Neurourology and Urodynamics found that shifting fluid intake earlier in the day, without reducing total volume, produce nocturia reductions comparable to those seen with pharmaceutical interventions, specifically in adults whose nocturia was driven primarily by nocturnal polyuria rather than bladder dysfunction. After 6 p.m., small sips to manage thirst are appropriate and important for hydration and cardiovascular health. The goal is not to go to bed thirsty, that introduces its own cardiovascular risk. The goal is to avoid consuming large volumes of fluid in the final 2 to 3 hours before sleep. Supporting habit. 3. Take a 20 to 25 minute walk between 6 and 8 p.m. The calf muscles serve as a peripheral venous pump. When they contract during walking, they compress the deep venous system of the lower legs and drive accumulated fluid upward toward the central circulation. This mechanism is separate from leg elevation, but complementary to it. Where elevation uses gravity to return fluid passively, the calf muscle pump actively propels it. Research from the International Journal of Urology found that a 30-minute evening walk completed at least 2 hours before bed reduced average nocturia episodes from 2.7 to 1.4 over 4 weeks in adults over 60, a reduction of nearly 1 full nighttime awakening per night from walking alone. The timing window of 6 to 8 p.m. serves 2 purposes. It is late enough to address the fluid accumulation that builds through the afternoon, and it is early enough that the elevated core temperature from exercise does not interfere with sleep onset. Walking too close to bed delays sleep initiation, adding a separate mechanism for nighttime waking. 20 to 25 minutes of moderate pace walking. The pace should be sufficient to feel the calf muscles engaging, not strolling, not racing. Between 6 and 8 p.m., supporting habit 4, eliminate caffeine after 2 p.m. Caffeine is a direct diuretic. It inhibits the reabsorption of sodium in the kidneys, drawing water into the urine and increasing output. This effect is well documented and widely understood. What is less widely understood is how long it persists, particularly in adults over 50. Caffeine half-life in the human body ranges from 4 to 6 hours in younger adults. After 50, hepatic metabolism slows, and caffeine clearance extends to 6 to 8 hours or longer. Research published in the Journal of Clinical Pharmacology confirmed that adults over 55 showed significantly prolonged caffeine half-lives compared to younger controls, meaning the diuretic effect of an afternoon coffee persists well into the overnight hours. A cup of coffee at 3 p.m. can still be producing measurable diuretic activity at 10 p.m. or 11 p.m., i.e., the exact window when the leg elevation intervention is working to reduce fluid load and when the kidneys should be receiving the signal to concentrate urine and reduce overnight production. Caffeine consumed after 2 p.m. works directly against every other intervention on this list. It increases the overnight urine volume that leg elevation is trying to reduce. It competes with ADH, the hormone that slows kidney filtration during sleep, and it impairs sleep architecture independently, reducing time in deep sleep and making the partial arousals caused by bladder filling more likely to become full awakenings. The cutoff is 2 p.m. That applies to coffee, black tea, green tea, energy drinks, and pre-workout supplements. Herbal teas, with the exception of yerba mate, are caffeine-free and safe for evening consumption. The full picture looks like this. Between 5 and 7 p.m., elevate the legs for 60 minutes above heart level. This is the primary intervention, the one that directly intercepts the fluid redistribution mechanism before it drives overnight urine production. Before and alongside that, keep dinner sodium below 600 milligrams to limit how much fluid accumulates in the first place. Take a 20 to 25 minute walk between 6 and 8 p.m. to activate the calf muscle pump and clear remaining lower extremity fluid through active venous return. Move the majority of fluid consumption to before 6 p.m. Eliminate caffeine after 2 p.m. Research on multi-component behavioral interventions for nocturia in adults over 60 consistently shows that combining these habits produces reductions of 2 or more nighttime bathroom visits per night, with some trials reporting complete resolution of nocturia in participants who previously averaged 3 or 4 awakenings. The difference between one intervention and all 5 is not marginal. The fluid redistribution mechanism has multiple inputs. Addressing all of them simultaneously removes more of the overnight fluid load than any single habit can accomplish alone. To recap, the primary intervention, leg elevation for 60 minutes between 5 and 7 p.m., directly clears the lower extremity fluid accumulation that drives nocturnal polyuria before it redistributes into the circulation during sleep. Supporting habit 1, reduce evening sodium to limit how much fluid is retained in the lower extremities to begin with. Supporting habit 2, front-load fluid intake before 6 p.m. to minimize the overnight kidney filtration burden without restricting total daily hydration. Supporting habit 3, walk for 20 to 25 minutes between 6 and 8 p.m. to actively pump residual lower extremity fluid through the calf muscle mechanism. Supporting habit 4, cut caffeine after 2 p.m. to allow ADH to function without competition during the overnight hours. If someone in your life has accepted multiple nightly awakenings as the inevitable price of getting older, share this. The research is clear that for the majority of adults over 60, nocturia is a fluid management problem, not an aging problem. And fluid management is something that can be changed starting tonight. Now that the full mechanism behind nighttime urination is understood, the next step for those who want to build a complete and lasting system around it, the description has a full nocturia protocol that goes deeper than this video can cover. It includes the specific magnesium and vitamin D supplementation shown in clinical trials to support overnight ADH function, the bladder retraining sequence that improves capacity over time, and the sleep positioning adjustments that reduce partial arousals from bladder filling, built specifically for adults over 50 who are done negotiating with broken sleep. The link is in the description below or pinned at the top of the comments. One full night of uninterrupted sleep is not a luxury. According to the research, for most people reading this, it is 60 minutes of leg elevation away.